We are expecting an increase in the number of cases, but it's not completely clear if that can be slow or little increases going up and down and up and down and an increasing way. If that it can be a sudden increase, but I think it probably will not be exactly the same in all member states. That will depend on how the virus is circulating in a particular society, in a particular environment, and to what extent these physical and non-medical measures are being implemented that together what has been the situation of the previous wave or the previous increase, and that putting those things together, I mean, we can guess that, well, in some places there can be a sudden increase, but in others maybe the behavior will not be like that.
Joseph, I want to ask you about the latest comments from WHO as we continue to collect more information around the virus and effectively saying they can't rule out the possibility that the virus may be airborne. This feels like we've circled right back to where we started around the transmission of the virus potentially being an aerosol format. What does that mean? Because clearly inside that means one thing when you've got stagnant air and not a lot of fresh airflow versus outside where there might be more airflow breaking down the particles or potentially not. It raises so many possibilities. What are you hearing and what do you think we're dealing with?
Yeah, most likely there is this potential for aerosol transmission. In our documents in EU CDC, in European Center for Disease Prevention and Control, that has never been discarded. So it's something that we know, for example, in the case outbreak in Korea, in South Korea, when there was people singing and being in a closed environment for a long period of time. There were some cases, an outbreak there. And there have been some studies there looking at how far those droplets can travel if the environment is completely closed. Also, there are some examples in choirs and then how the transmission has gone. So definitely, differently from other viruses, this is something that has to be seriously taken into account and considered in terms of the prevention measures.
I want to pick you up on that point in terms of prevention measures. If the virus is transmitted through the air, like the WHO is now acknowledging is a real possibility, there are huge discrepancies around Europe in terms of the adoption of wearing masks. If you look at Southern Europe, Italy and Spain, people have widely embraced the wearing of masks, but then in Northern Europe and places like Denmark, Sweden, even here in the UK, it's much less prevalent, the wearing of masks. So why shouldn't European governments mandate that people wear masks?
Well, because of, as you know, and everybody is mentioning, the evidence for each measure is going slowly. So if we look back at 3 months ago, recommendation of mask was quite weak in terms of saying that it's something to protect others, but will not protect you. Then aerosols was not in the pipeline, was not of the main issues of debate. Currently, as far as the evidence is increasing, the use and the benefit of a face mask is increasing. But I think other measures have to be clearly stated, like good ventilation in closed spaces, again and again insisting in the respiratory etiquette, this sign, just protecting the way that you sneeze and you cough, and then when you are strongly breathing, with your arm and not with your hands, this is essential. So I think it has to be a combination, because what we have many times said is that using mask and putting that just as the main and the central measure can bring to this false sense of safety. Once I'm using mask, I don't need to do anything else. And that's not the case. So as I said, clear ventilation of spaces, respiratory etiquette, together with the other measures, that is the clue, and that's the way forward with that.